Welcome to the Treatment Explainer channel, your go-to resource for comprehensive and compassionate insights into the world of medical treatments and conditions. Today, we are delving deep into the human mind to unmask a mental health disorder often misunderstood and stigmatized: schizophrenia. Schizophrenia affects approximately 20 million people worldwide. It's a complex, long-term medical illness affecting a person's thoughts, feelings, and behavior. Despite its prevalence, schizophrenia is often misunderstood, leading to a lack of empathy and support for those affected. Did you know that schizophrenia does not equate to having a split personality, as often portrayed in popular culture? That's just one of many myths we'll be debunking today. Furthermore, schizophrenia doesn't just manifest through hallucinations or delusions, the so-called positive symptoms. It's equally characterized by negative symptoms. These include difficulties with motivation, emotional expression, and social engagement. In our journey today, we'll explore these negative symptoms of schizophrenia, discuss how schizophrenia can be treated with medication, and highlight some of the innovative treatment methods being developed in the field. Our goal? To enhance understanding, destigmatize the conversation around schizophrenia, and empower those affected with knowledge and hope. So if you've ever wanted to understand schizophrenia beyond the headlines and stereotypes, stay with us as we illuminate the reality of this condition and the transformative powers of its treatments. Let's begin this enlightening journey together. Exploring the negative symptoms of schizophrenia. The term negative symptoms can sound quite confusing. Unlike what it might imply, it's not about a patient harboring negative thoughts or emotions. In the context of schizophrenia, negative refers to aspects of normal emotional or behavioral functioning that appear to be diminishing or absent. Negative symptoms include a lack of motivation or apathy, diminished emotional expressiveness, and difficulties in initiating and sustaining activities. These symptoms can be quite debilitating as they interfere with a person's ability to carry out everyday tasks, maintain social relationships, and lead a fulfilling life. Interestingly, while schizophrenia is often portrayed in media with a focus on positive symptoms, like hallucinations and delusions, it's these negative symptoms that are frequently more persistent and harder to treat. They can exist in the background long before a person has their first acute episode, and often remain even when positive symptoms have been successfully managed with medication. Understanding these symptoms is critical not just for those living with schizophrenia, but also for their loved ones and caregivers. It helps to foster empathy, ensures appropriate support, and guides treatment plans that cater to specific challenges. The recognition of these symptoms as a core component of schizophrenia has grown over the years, leading to more targeted and comprehensive treatment strategies. And this is where we start to see a glimmer of hope. Over the years, medical research has made significant strides in understanding schizophrenia and how to manage it. Medication plays a crucial role in this journey, especially in treating the positive symptoms of schizophrenia, like hallucinations and delusions. Antipsychotic medications are the most commonly prescribed for treating schizophrenia. These drugs work by affecting the neurotransmitters in the brain, particularly dopamine, which is believed to be a significant factor in the onset of schizophrenia symptoms. While medication may not cure schizophrenia, it can effectively manage symptoms and prevent relapses, allowing individuals to lead more fulfilling lives. However, like all treatments, medications for schizophrenia also come with potential side effects, including drowsiness, restlessness, and metabolic changes. It's crucial that the benefits and risks are considered and discussed openly with healthcare providers. But what about negative symptoms we discussed earlier? Can they be managed with medication too? While current medications are less effective against these symptoms, the research is ongoing. Pharmaceutical companies and researchers worldwide are developing and testing new drugs specifically targeting negative symptoms. offering a beacon of hope for more comprehensive and efficient treatment. Remember, the goal is not just about managing symptoms, but empowering individuals with schizophrenia to lead fulfilling and empowered lives. Beyond medication, a new horizon of innovative treatments is unfolding, specifically targeting the negative symptoms of schizophrenia. Today, a holistic approach to treatment is increasingly being adopted, one that addresses both the medical and psychosocial aspects of the disorder. Cognitive behavioral therapy, or CBT, for example, has shown promise in managing negative symptoms. This form of therapy helps patients challenge distorted thought patterns, enabling them to change their behavior and reaction to various situations. Social skills training and vocational rehabilitation are also playing a pivotal role in improving social engagement and occupational functioning among individuals with schizophrenia. Empowering these individuals to lead more independent lives is a key goal of such interventions. Looking towards the future, emerging therapies are being explored. Virtual reality therapy, which allows patients to navigate through digitally created environments to learn better coping mechanisms, and genomic medicine, focusing on how an individual's genetic makeup can inform personalized treatment, are both promising areas of research. The journey towards more effective treatment for schizophrenia's negative symptoms is far from over, but with each new discovery, with every step forward, we inch toward a world where living with schizophrenia doesn't mean living in the shadows. Now, let's shift our focus to the people at the heart of this conversation, individuals who live with schizophrenia every day. Their stories offer unique insights into the realities of this condition and the transformative power of appropriate treatment and support. One such story is of John, an artist who found that his schizophrenia negative symptoms treatment helped him rekindle his passion for painting. His artwork now serves as an expression of his experiences and a beacon of hope for others navigating similar journeys. Then there's Kristen, a writer who uses her skills to educate others about schizophrenia symptoms and treatment. After battling social withdrawal, one of the negative symptoms of schizophrenia, she's now an active member of an online support group, offering advice and encouragement to those newly diagnosed. Through therapy, medication, and peer support, both John and Kristen have managed to regain control of their lives. They are not defined by their diagnosis, but rather by their resilience and their contributions to their communities. And this is precisely what our channel Treatment Explained is all about, understanding conditions like schizophrenia, exploring the treatments available, and empowering people with knowledge and hope. Remember, schizophrenia can be treated with medication and various other therapies. And while the path may not always be straightforward, with the right treatment and support, individuals with schizophrenia can lead fulfilling, productive lives. Thank you for joining us today. And if you found this video insightful, do consider subscribing to our channel for more such content. Stay informed and stay empowered.